The analysis and interpretation is the heart of the analytical phase of research. This is a stage where all the data we have collected during the empirical phase are carefully examined, summarized, and explained. This is the stage where we transform raw information into meaningful findings. In short, this phase is where research truly comes to life because it is where we begin to answer our research questions and test our hypotheses. The ultimate goal is to derive insights that are logical, evidence based, and useful for nursing practice. Data analysis is the systematic process of organizing, summarizing, and evaluating data to reveal important patterns, relationships, and trends. Think of it as sorting and making sense of your data, turning hundreds of responses or observations into organized information. For example, if you surveyed student nurses about stress levels, data analysis would help you identify common stressors, differences between male and female respondents, and the overall trends. It also serves as the bridge between data collection and conclusion, linking what we observed with what we can infer scientifically. Once the data are analyzed, the next step is to interpret what those results actually mean. Data interpretation involves assigning meaning to analyzed data, while analysis answers, "What did we find?" Interpretation answers, "What does this mean?" It connects numerical results to theoretical concepts and real world implications. For instance, a statistically significant reduction in anxiety after health education implies that nursing interventions can truly improve mental well being. In simple terms, interpretation helps researchers explain what the numbers mean in the context of nursing practice and patient outcomes. The analysis and interpretation phase is important because number one, it ensures accuracy and logical reasoning in our conclusions. Without careful analysis, findings can be misleading. It also guides evidence based decision making in nursing practice, allowing us to plan interventions that are scientifically supported. It also links research findings to theories, policy, and practice. For example, if your research identifies a gap in patient education, your results could inform hospital protocols or community health programs. Before performing analysis, three key preparations are needed. First, you need to review the research questions and hypotheses. This ensures that the analysis aligns with your study objectives. You also need to clean and verify data for accuracy and completeness. Remove duplicates, check for missing values, and confirm that all responses are valid. Then choose the appropriate statistical or qualitative methods based on your data type and level of measurement. For instance, you use t-tests for interval data and chi-square for nominal data. Proper preparation avoids errors and strengthens the credibility of your results. Quantitative analysis deals with numerical and measurable data. It relies heavily on statistical tools, both descriptive and inferential statistics, to summarize and test relationships. Example is a researcher may compute the mean BP before and after a health intervention, or use a t-test to determine if the difference is significant. This method is objective and precise, making it ideal for studies that seek measurable outcomes like vital signs, satisfaction scores, or incidence rates. However, in the context of qualitative data, we use qualitative data analysis. This focuses on non numerical information, such as words, behaviors, and narratives. This type of analysis involves coding, categorizing, and identifying themes from interviews or observations. For instance, if nurses were interviewed about their experience caring for terminally ill patients, you might find themes like emotional burden, coping through faith, or need for support. These themes help us understand human experiences that numbers alone cannot explain. Sometimes, researchers use both approaches together. This is called the mixed method analysis. Mixed method analysis combines both quantitative and qualitative techniques to achieve a deeper understanding of the research problem. For instance, you might first conduct a survey to measure stress levels among nurses, the quantitative data, then follow up with interviews to explore the reasons behind the stress. For qualitative data, the quantitative results show measurable trends, while the qualitative findings provide context and explanation. This approach promotes a comprehensive and balanced view of the phenomenon being studied. The steps in quantitative data analysis starts with editing and coding of data for consistency. We need to check responses for consistency and assign numerical codes to categories. Next is tabulation. Organize data into tables for easier review. And computation, which is applying appropriate statistical tools, followed by interpretation. This is linking findings back to hypotheses and related literature. For example, in a study on the effect of health education on blood sugar control, the researcher would compute mean blood sugar levels before and after the program and determine whether the change is significant. Meanwhile, the process of qualitative analysis involves first, data organization. This entails transcribing interviews, sorting field notes, and preparing them for analysis. Next is familiarization. This entails reading and rereading the data to become immersed in it. And then coding and categorization. This is identifying keywords, phrases, or ideas that capture meaning, followed by theme development and interpretation. Group related codes into themes that reflect the essence of participants' experiences. For example, in studying caregivers of stroke patients, themes might include fatigue, family support, or hope for recovery. Once data are analyzed, we interpret results according to the type of research. In interpreting statistical results for quantitative tests, we remember to number one, relate findings to your research objectives. Always return to your main questions. Did you achieve your purpose? Next is to discuss direction, strength, and significance of relationships. For example, is there a strong correlation between hours of sleep and academic performance? Next is present both statistical and clinical significance. A result may be statistically significant but not clinically meaningful. We need to evaluate both perspectives. In qualitative research, we focus on the meaning and context behind the data. When interpreting qualitative data, we emphasize context, meaning, and participant perspectives. Interpretation should capture how participants understand their experiences. Next, relate identified themes to existing theories or frameworks. For instance, linking coping themes to Lazarus' stress and coping theory. Also, use direct quotes or field notes to support findings and give participants a voice. There are some or common pitfalls that researchers must avoid in the analysis phase. Be careful not to misuse statistical tools or wrong label of measurements. For example, using a parametric test for nominal data. Next is overgeneralizing results from small or non representative samples. Another one is ignoring confounding variables. These are factors that might influence results, such as age or environment. These mistakes weaken the credibility of your findings and can lead to incorrect conclusions. Another essential aspect of the analytical phase is upholding research ethics. Make sure to report all results honestly, including those that are not statistically significant. Maintain confidentiality and data integrity. Do not reveal participant identities. Avoid data manipulation or selective reporting. Every data point matters, even those that do not support your hypothesis. Integrity is a hallmark of trustworthy research. As future nurses and researchers, we must hold ourselves to the highest ethical standards. In summary, data analysis and interpretation transforms raw data into knowledge. This process demands accuracy, objectivity, and theoretical grounding. Proper interpretation ensures that findings are relevant, applicable to nursing research and practice. Ultimately, the analytical phase allows nurses to turn data into evidence that can improve patient care, influence policy, and strengthen the profession.